Your baby's road to a healthy future continues after you leave the hospital. You may meet the public health nurse while you're in hospital, or perhaps receive a phone call at home. Public health offers support and programs that are designed to help you protect your child's health. Two important programs that are available to all parents are immunization and healthy toddler assessment. During pregnancy, you may qualify for unique public health supports and services. To see if you are eligible, call the public health office in your area. Phone numbers are on the last slide. Immunizations, or vaccinations, are an important part of keeping your baby healthy, not only as a child, but throughout their lifetime. As a parent, it's normal to have questions about vaccines. Learn how vaccines work, why they are needed, and how they are given to help you feel informed and confident about vaccinating your child. Talk with a public health nurse, your primary care provider, or pharmacist to get the correct information. Vaccines are safe and effective. By saying yes, you are helping to protect you or your child against diseases caused by certain viruses and bacteria. Immunization is one of the most powerful and cost-effective tools to prevent, control, and manage vaccine-preventable diseases. Some vaccines may need to be repeated throughout life, so family members may wish to check with their primary care provider about their own immunization status before baby arrives. Immunization services may also be available via your primary care provider. You will be required to make many decisions for your child during their early years. Informed consent is when you, as a parent, feel you have received enough information to be comfortable making a decision for your child. There are numerous reputable websites available for families to do research on vaccination. These include Government of New Brunswick, Horizon Health, Immunize Canada, and Public Health Agency of Canada. The first vaccine your baby will be offered protects them against hepatitis B. Hepatitis B is a contagious viral infection of the liver. The disease can be short-term, acute, or long-term, chronic. Hepatitis B vaccine is the best way to protect against hepatitis B infection and its complications. The vaccine provides good protection against hepatitis B, especially if given at an earlier age. Hepatitis B vaccine is provided to children as part of the New Brunswick Routine Immunization Program. It is given in a series of 3 doses, at birth, 2 months, and 6 months. The vaccine is given at the same time as other routine childhood immunizations. Once you give consent, your child will receive their hepatitis B vaccine shortly after birth during routine assessments and procedures. To receive the next vaccine on time, call the public health office in your area to make an appointment, or talk with your primary care provider about an appointment. Further information about hepatitis B and other immunizations can be found on the GNB website. Your baby will receive other vaccines at various time points. Refer to the routine immunization schedule and your child's vaccine record, you received this in hospital, for the schedule. While immunizations can be momentarily painful, there are things you can do to help keep your child comfortable throughout each of their immunizations. Breastfeed. Start about 5 minutes ahead of the needle and continue afterwards. This helps to reduce pain perception and comforts your baby or child. Skin-to-skin contact also helps. If you aren't breastfeeding, providing skin-to-skin contact and sucking on a soother can help with pain. Relax. Your child may react to your emotions. When you relax and stay positive, your child will be happier too. Distract. Your gentle, soothing voice or touch can help comfort your baby. So can a favorite toy, telling a story, or singing. It is important that once you begin your child's immunization series, that their appointments remain on time according to the New Brunswick Routine Immunization Schedule. This schedule can be found on the back of your child's green immunization record, which will be provided to you upon discharge from the hospital if your baby received their hepatitis B vaccine. You will bring this with you to each immunization appointment where it will be updated. This record should be returned to you after each appointment and kept safe. The Healthy Toddler Assessment is a universal assessment offered to all children in New Brunswick at the age of 18 months. At this time, families are strongly encouraged to make an appointment with public health to assess the growth and development of their child. This is also a unique opportunity for parents to ask questions and raise any concerns they may have. When it comes to detecting health concerns in children, sooner is better. The Healthy Toddler Assessment is offered to all children in New Brunswick when they turn 18 months old. The purpose is to assess and support the healthy growth and development of young children and their families. Children are able to have the assessment up until they turn 2 years of age. During this assessment, a public health nurse will evaluate the child's growth and development, including language development, physical skills, personal and social relationships, dental, vision, and hearing, and they will also provide advice on nutrition, safety, vaccines, and answer any questions parents may have. If necessary, public health will refer the child to other professionals or services. You can call your local public health office to book an appointment or to find out more information on public health programs which may be available for you and your baby.